All right, everyone, and welcome to A Day in the Life. Today, I'm joined by my friend Katie, who is a community pharmacist. Katie and I both went to Presbyterian College, and she's always been my go-to person. She's always on top of things, knows everything about everyone. It's just a joy to be around. After we graduated, Katie stayed on at Presbyterian to get her pharmacy degree. She now has her doctorate in pharmacy, works as a pharmacist, and recently got married. Welcome, Katie.
Hi, Rachel.
Yeah. So ever since I met you, you knew that you were going to pharmacy school. How long did you know that you wanted to be a pharmacist?
I always knew that I wanted to be in some sort of science or math field. It's just what interested me when I was in high school. When my grandparents came to visit, my grandmother got a sunburn sitting in our kitchen, what looked like a sunburn. And that really made no sense to me. And it didn't make any sense to her either. And after doing a little bit of investigating, I found out there was a drug-drug interaction, some side effects that really could have caused that no one had ever warned her about. And my grandparents lived 700 miles away from us. I thought to myself, whose job is it to make sure that people understands the medicines they take? And at that moment, thought to myself, I could be a pharmacist. I could see myself doing that for a living and doing that full time, taking care of other people's family members, like they're one of their own. For me, it was never kind of in the cards to be a doctor or a nurse. I kind of like having a counter between you and me. Um, Hands-on was really not my speed, but I get to do sort of the academic part of being in the medical field and answering those questions and making sure people understand the medications they put into their body before they get there.
Great. And I think that's really important because there's a lot of side effects and, like you said, drug interactions that happen. So it's really great to have people like you to help us make more informed decisions. And as far as I know, I don't know this. That's why I'm curious to ask. You never seemed to waver from that path while we were in college. I know I was all over the place with what I wanted to do for my job, but you always knew you wanted to be a pharmacist. Have you ever doubted your career path?
I think everyone has like that moment of panic when they're going into a career that they think to themselves, what if I hate this? What if this really isn't for me? And I think I had that when I was actually shadowing the summer before our senior year of college started. I was walking up the front steps of an independent pharmacy in town, and I was spending my Saturdays there all summer. And as I went to open that front door for the first time, I thought to myself, I've never actually worked in a pharmacy before today. Like, I've never stood behind the counter. And I think conceptually liking the thought of doing something and actually seeing it in action and saying, could I really see myself doing this every day as a career is two different things. I think every once in a while, especially after a bad day at work or something hasn't gone quite the way I expect it to, there are moments that I sit there and think to myself, like, why do I do this every day? And when I sit back and think, what else would I do if not this? And the answer is I can never come up with anything I'm better suited for. And so I think at that point you realize that your heart's kind of in the right place. And what you're doing is important to who you are and your interests and your passions. And I think that's really important. So yeah, there are moments I definitely question it. Kind of in this season of COVID, it's been one of those things, how much can I give of myself before I kind of burn out? But at the end of the day, I walk into work and I make a difference in someone else's life every day. And I don't know that I could say that doing any other job.
Yeah, nice. So yeah, one thing I'm curious about is what are the different paths in the pharmacy world that people can get into besides, I guess, what you see every day in a pharmacy?
Sure. So most people, when they think of pharmacy, think about a community pharmacist, the person who stands behind the counter and makes sure that the correct drugs make it to you, the patient. But pharmacists are really embedded into almost every aspect of the healthcare community. So there are pharmacists that check orders in the hospital. There are folks who live on the drug development side. They're educating providers about new drugs, things that are coming out, answering questions for pharmacists when we don't have the answers. As kind of a liaison to the healthcare community within those companies. There are folks who own their own businesses. They do really innovative things from compounding medications to pharmacogenomic education. There are folks who work for your insurance company. There are pharmacists there on the team who are helping make those decisions. What medications is your insurance going to pay for? Those those decisions don't just kind of come out of thin air. There's a lot of kind of work that goes in behind the scenes about efficacy and price and how much impact can we make for how many dollars. And so there's pharmacists involved in all those decisions on a day-to-day basis.
Do you ever think about going into one of those?
I've really thought about it. I think long term, I would love to either be in academia, so helping other student pharmacists become pharmacists, or in an ambulatory care setting. I think that's something relatively new for the pharmacy profession, is having pharmacists embedded in sort of your primary care clinics. So as part of your team with your doctors and your nurses, when you go in and see a general practitioner, making sure that you're on the best medications for you, that you understand, because I think as a whole, the medical community is kind of under pressure to do more with less every day. And I think really diversifying your team and having a pharmacist there, they've got a unique specialty in drug management, medication therapy management, and it's very different from what your doctor, your nurse, your physician's assistant was trained to do. And so I think having someone there in-house to answer those questions and kind of defer to in certain situations is really important. I could really see myself doing something like that.
Yeah, I could see you doing that too. So one question I have is just like, what's something that pharmacists are trained to do that nobody knows about or asks you to do? I have like a little story about that where I admit like I'm pretty ignorant about it. And like I remember when I was in college and I had a cold or something and I didn't know what like I guess cold medicine I should take. My mom was like, you should talk to the pharmacist. And I was like, I didn't know I could talk to the pharmacist about that. I just thought pharmacists like gave me my prescription.
So that's probably the biggest thing. And I think what most people don't realize is the vast majority of pharmacists who stand behind the counter have a doctorate degree at this point. They have since the early 90s. And every day you walk in and when you sign out your prescriptions, in most states you sign, yes, I accept counseling, or no, I decline it. And that means that the pharmacist is there to make sure you get the most benefit out of your medications, whether they're prescription or over the counter. That pharmacist is there to answer those questions. And so it's kind of my personal mission. My hope would be that everyone leaves a pharmacy knowing what medication they're living with, how it's going to benefit them, and what they can expect from taking it, the good, the bad, and the ugly, because every medication has an intended purpose, but it also is going to have some side effects. And so being aware with how you should handle that, and when you kind of need to follow up either with a pharmacist or with the prescriber themselves, I think that's really valuable. And most people don't realize that you can walk up and ask those questions, and the pharmacist is ready and they're willing to answer them. That's part of the job. That's part of the reason we're there in the building.
Yeah. So one question I have is, all right, so like maybe the doctor has prescribed 3 or 4 or 2 or 3 different medications, but then maybe they overlooked something and the 2 medications don't interact well. What do you do as a pharmacist in that situation?
So as a pharmacist in that situation, that's one of the primary things I do. So on a regular day, your prescriptions come in either on paper or via fax. The doctor has physically picked up the phone and called them in. Most commonly, they're coming across electronically at this point. And so you start with a pharmacy technician who's going to actually key those prescriptions in. And the first thing that I do as a pharmacist when I touch those prescriptions is make sure not only did we type it in correctly to make sure that the drug we've selected and the instructions we have on there are correct coming to you, the patient, but that it matches what's going on in your medication history. So can you take it with the other medications that are on your profile? Is that safe? Is there something we should be concerned of based on where you are in your life, whether that's age or other disease states, whether or not you're pregnant? All those things are going to impact the safety of those medications. And so that's the first screen that I do as a pharmacist. When I hit that point that something throws a red flag, the instructions aren't quite right, that might not be the dose I usually see. It's a high dose for you taking it as a first-time patient. It's a low dose. All those things, I will take a stop and we'll actually call the physician's office and reach out. I may get to speak to the prescriber directly, or I may have to leave a message and wait for a call back. And that's probably the biggest kind of time constraint in the process, because I'm not staying there. I can't just turn around and ask. I don't have a magic back door to reach your prescriber. And so when there's some question that arises, we got to take up and just wait for the answer to come in. And the reality is that may happen in 10 minutes, or that may happen tomorrow morning, which is really frustrating if you're the one waiting on the medication. But my primary concern is that the medicine you receive is both safe and effective for you. And if we can't check off both those boxes, then I'm going to sit on that pause button until we can.
Yeah, the life of a prescription that no one knows about. Super interesting. You're like, I had no idea there were all those different steps.
So that's not even considering what may happen with your insurance, because that's a third party. And so there may be a protocol in place that, hey, this isn't the prescription and we prefer to pay for is the insurance. So now I got to call the doctor back and say, hey, this isn't the insurance's preferred drug. Out of pocket, this may cost the patient hundreds of dollars. If we switch them to this medication that's covered by their third party payer, all of a sudden we can bring that cost way down for you. And so that's another thing that we do to kind of intervene. But again, those things, they take time to make happen because we're not all in the same location. We got to kind of wait to get in touch and touch base with the physician, let them review that recommendation. So some of those things don't really happen in real time. Others might. And so that's kind of where it's valuable. If somebody's embedded in the physician's clinic or sitting there with your nurse practitioner, with your PA, they can sit there and say, hey, in real time, their insurance doesn't cover this without a prior authorization. And so if the insurance needs more information that we have to provide to them as the healthcare team, that may take a couple of days to turn around. And so being able to kind of set realistic expectations, like, we think this is the best medicine for you, but it may take us a couple of days to get it through on the insurance. Let the pharmacy call you when it's ready. They'll kind of keep you up to date instead of that being a surprise when you get there and, oh, it's not ready and this is why. And so kind of working together as a team really improves that for the general public.
I guess what about when maybe your condition is urgent? What then?
So some of those things, judgment call is a big one. So something I see pretty frequently, patients with penicillin allergies. Most people don't have a true penicillin allergy where if they take penicillin, they're going to go into anaphylactic shock. They're going to have trouble breathing. Their blood pressure is going to drop. That's not the case for most people. Most people had a reaction because they took amoxicillin as a kid and they had a virus and not a bacterial infection. So there's going to be some skin reaction there. So all of a sudden we document a penicillin allergy and that wipes out a whole ton of antibiotics I can't take, which is really tough from a therapy standpoint. Now, if I'm checking my drug interaction software that's built into the computer system in the pharmacy, there are a lot of drugs that will have some cross reactivity with that penicillin. And so some of those things I flag and say, hey, we just need to touch base with the person, make sure that they understand that, there is a chance that they could react to this because they've got a listed penicillin allergy. It's a really small chance, 1-2%, but I want you to be aware of that before you walk out of here, kind of knowing the risk versus the benefit, but I want to make sure that that potentially this could react. And that's the same thing I would tell the prescriber if I had to call them and we were to talk about it over the phone. At some point, I may or may not get an answer from that doctor, but making you, the patient, aware there's a potential for the reaction, we can make that educated decision together. It's the same conclusion we would likely reach if you, the prescriber, and I, the pharmacist, we're all stating their choice. And so there are some things that I feel comfortable pushing through going, we just need to have that consultation one-on-one, the patient and I, that counseling moment. And there are other things that, sometimes scripts come over with 3 different sets of directions. It's a computer error.
We were talking before about like, okay, this is flu shot season and there's the COVID vaccine going on. So what's that whole like immunization process like behind the scenes?
Sure. So immunizations are different in every state. I will tell you that up front. Pharmacy is actually regulated at the state level. So what pharmacists are allowed to do by law and kind of what falls into the scope of practice for a pharmacist differs by state. So in South Carolina, I actually have the authority to administer immunizations to adult patients. There's a whole list and some requirements about training, but for the most part, folks who are over 18, so adult patients, can walk into the pharmacy, fill out a consent form. We have a discussion about what vaccines they're due for based on what's in our state's health system database at the state level for our Department of Health, and then we administer those recommended vaccines. So really quick and easy. Here in the time of COVID, I do have some additional authority under the PrEP Act. And so I've got a little more leeway. I give some childhood vaccines, which is something that I haven't done historically. I've given additional flu shots, and we've given COVID shots. That authority has been expanded to cover some specially trained pharmacy technicians as well. And so that's probably one of my favorite things to do over the course of the day is make sure that people are getting the preventative care they need in early COVID times. So it's really strange because I was a pharmacist less than 6 months before COVID kind of rocked the healthcare world and the world in general. And people ask, what's it like being a pharmacist post COVID or in COVID times? And I said, well, I didn't really know what it was like to be a pharmacist before, so it's hard to compare it to anything. But when people first started panicking, what do we do? The two things I guaranteed them was, your pharmacy is not going to close. The doctor's office may close, but I'm the gatekeeper of your medicines. We'll be here. No matter what happens, we will find a way, and pharmacy has found a way. The second thing that we really did was make sure people's vaccines are up to date, because pneumonia and flu co-infections were a big concern with COVID, and they still are. Lots of folks who wind up in the ICU with COVID's as big an issue as pneumonia is for them. And so you can get one infection on top of the other. So making sure folks were up to date on those additional vaccines. So we're preventing disease where we can. With the COVID vaccine too, pharmacy has really stepped up in a big way, and pharmacists have been the #1 administrators of the COVID vaccine across the country. And so that's something I always encourage people. If you don't know who to turn to, if your pharmacist can't give you a vaccine you need, they can point you in the direction of someone who can. And really knowledgeable about identifying which vaccines you might need, whether you're just living your daily life at home or if you're traveling abroad and you may need some additional protection from diseases that aren't necessarily prevalent here.
Cool. So this might be, you might have already answered this, but what's your favorite thing about being a pharmacist?
That's hard. I think it changes on the day. I like that no 2 days are exactly the same. Sometimes that feels like a blessing, and sometimes that feels like a curse. But I mean, I walk in and I'm in the pharmacy 12 hours a day on days that I work during the week. And so from the time I walk in at 9 until I leave at 9, there's no telling what questions are going to walk up to the counter, what my patients are going to need, what calls are going to come in from physicians needing a recommendation. There's no limit to what I'm going to handle in a day. And so I think that's really fun, that there's a certain amount of variety that I get to do in a day and get to experience. But I really love feeling like I've made a difference in someone's day, in someone's life. And people don't come to a pharmacy because they're inherently well. Usually you're picking up medicine because you're sick, because you have some sort of underlying long-term healthcare condition. And so being able to be that support system on a daily basis and, make sure people understand, not just taking the medicine, but if you have high blood pressure, what are some of those other factors in your daily life that we can address? What's your motivation for keeping your diabetes in check? What does this look like in the long term if we stay on the path we're on? I think some people just need someone to lean on and someone to help them through, because it takes a toll. It takes a toll on you to have to live with a disease state every day. And I think having someone kind of in your corner who's always there, who's always going to be available, which isn't necessarily the case with someone who's sitting in your 9 to 5 doctor's office. I'm there long after the doctor's office closes. And so if you've got a question after hours, I'm not sure, hey, do I need to make an appointment with my GP tomorrow, or do I need to go to urgent care tonight? A lot of times the answer is, hey, you can wait it out, like manage the symptoms. If it gets better, great. We've saved you hundreds of dollars in an ER visit. Or, this really is a time that you're having an emergency and you need to hand over the keys to somebody else and let them drive. Having someone there to kind of have your back in the general public who's open for questions and just a phone call away on a regular day is really valuable. And I think being that person on the other end of the phone has really made a difference in my life on a lot of days.
Yeah, that's really cool. So it sounds like, so do you make like lifestyle recommendations for people like who have heart disease and diabetes? Like, is that some part of what you do?
It certainly is. And so that's one of the things that comes up on a regular basis, especially when people are frustrated, because when you're managing multiple medications a day and it just feels like, we keep tagging on more and more, there's a baseline for everyone. And depending on kind of where you fall on the spectrum, there are a certain number of medications you're going to have to take that are just part of the set that we know is going to keep you here on this earth longer with us, and is going to keep you out of the hospital, going to prevent some of these serious outcomes. And so there's a certain number of things that if people understand this is what's going to make the difference, this is what we know works. But when it's that third or fourth diabetes medicine that's getting added on, and I can't understand why I can't, I said, well, tell me about your day to day. And when I hear things like, I pick up my grande iced coffee on my way to work, and I eat my muffin, and then I sit at a desk all day, and then I may have pizza for lunch. It's not saying that none of those things are off limits if you have diabetes or if you have another disease state. But at what point does that iced coffee mean more than making it to your kid's wedding or their graduation someday down the road? Having your eyesight 15 years from now. And sometimes people just need to be told, like, this is what it looks like in the long run if your blood sugar keeps creeping up. And so where can we kind of make swaps? And that's what I encourage people to think of it as, not that I can't do this, but I can be there for all those things in the future if I swap something I'm doing now for something that's going to help me in the long run. And so whether that's something simple like adding a salad on and cutting back a couple of slices of pizza, or nixing the garlic bread on spaghetti night, it's those easy things. And I think, what's the one thing I'm willing to give up? What's the one thing I'm willing to trade in? And that's different for everybody. For some people, it's an hour. I'm willing to hit the gym an hour every day if it means I can keep having coffee every morning with sugar in it. Other people, it's, I'll give up soda cold turkey because I know there's 50 grams in every can I drink. No two people are exactly alike. And I think being able to talk to people and kind of meet them where they are in their lifestyle. I mean, I'm not going to go from I sit on my couch to marathon runner overnight, and being able to say that to, like, I'm never going to be a runner, but I enjoy dancing. Where is that physical activity that you love? Where does what brings you joy and brings you happiness meet what's good for your health? And I think that's different for everybody, and just being able to find that thing for you. And sometimes you just need a hand to do that. And so that's part of the job as a pharmacist.
Yeah, that's really cool. I had no idea you did that, helping them find their motivation or their goal to work towards keeping their health. Yeah, so I mean, you already said that you pretty much started your work as a pharmacist during the pandemic, but I guess what is a day in the life like for you?
So I think a day in the life kind of depends on what day of the week it is. And so as a community pharmacist, I work kind of set hours. I work relatively long shifts, but that means I work fewer shifts in a week, which is sometimes nice. I'm the one who comes in and unlocks the pharmacy every morning. I'll get us set up. The doctor's offices have opened an hour before we have, so there's already prescription orders waiting to be filled. There's medications that can't be filled early, so we're filling them the day they're due. We're working on getting that in motion before we roll back the gate at 9 a.m. And then beyond that, it could be anything, to be very honest with you. But it's processing prescriptions, making sure folks get things in a reasonable time, and kind of prioritizing, what do we need to take care of first? And sometimes, that's those acute medicines. Sometimes it's the screaming baby, because no one waiting on a prescription wants to have to wait there with an unhappy child, to be very honest with you. Sometimes it's stepping away from the counter to help people pick out over-the-counter medications, helping them locate a specific item in the store. It's all in a day's work. And so by the time I've left, I've processed usually 1,000 prescriptions coming in on our order. An average day, depending on which pharmacy you're in, sometimes I'll fill 100 prescriptions, sometimes I'll fill 500 or more. It just kind of depends. But every day brings variety for me, but there's some semblance of structure in that each prescription is going to take the same path from start to finish. So from the time we receive it from your doctor to when it gets put into your hands as a new prescription, or as a refill prescription, from the time it gets dropped in, hopefully with all your other prescriptions, a lot of pharmacies have an automatic refill program or a sync program. So somebody from the pharmacy is touching base to make sure we're filling the right prescription for you and making sure you get your refills ahead of when you need them. And so something that pharmacists are doing to make your life as a patient as easy as possible and make sure that your medication isn't taking over your life, it's supporting it.
Hmm, great. So yeah, you said you have long shifts and then you have your days off. What do you do to decompress from work?
It really depends on the day. I love to be outside. It's very nice that my younger sister also works healthcare. So every once in a while, we'll get off matching days, which is nice. And so we can go enjoy some sort of non-crowded hiking trails. We took up gardening this summer at home. It didn't go particularly well. The bugs ate most of our tomatoes. Um, but it was something just really relaxing to do on a day-to-day basis. Because I do work long shifts, that means all the things that I might do in the evenings or on the weekends kind of get crammed into my days off. So still have to do all of my regular chores or make appointments with my dentist, my doctor, myself. And so some of that happens on my day off as well. But there's definitely some playtime that goes in on days that I don't have to work at 12.
Yeah. You mentioned dancing. So do you and your husband go dancing?
Oh no, my poor husband has two left feet.
Oh.
And he's the first one to admit, he said, I really want to learn how to dance. I really want to be good at dancing. He said, I'm not good at dancing. But we do have a number of overlapping interests. And we do wind up spending a lot of time with both his family and mine because we actually both grew up in the area. And so a lot of our siblings are still local. And so we'll spend some time together. My siblings really love escape rooms. That's our go-to activity. And so we can puzzle our way out of an escape room pretty quickly. I've never not made it out, which is really fun. And
Nice.
we've probably done a few dozen at this point.
That's fun. Yeah, so speaking of your husband, how's newlywed life? Well, can I speak? Newlywed life been?
So it's been fun. I think we've had kind of an atypical honeymoon phase of our marriage, because my family received two cancer diagnoses since we got married at the end of April. So that's been really tough. My dad's been sick, and so it's been really fantastic to not be 2.5 hours apart, but to have my support system right there. And so we're definitely still adjusting to all the things that come with being newly married. And we grew up in different houses that do things different ways, and my standard of clean and his aren't always the same on everything. And so things that I would let slide, he's like, what are you doing? And other things I'm saying, going, do you not see this mess? But I mean, I think that's just part of living together and working together and creating a life together instead of in two different homes.
Yeah, new partnerships. Yeah, I'm curious. So so you both grew up Catholic. What are some of the differences that you're talking about? Are they like kind of in like those kind of traditions or like they other areas?
I think it's more in just like a difference in kind of family traditions. He is the oldest of six, and I'm the second oldest of four. And so I think we both kind of grew up in that big family mentality. I think he and his siblings were a lot more involved in activities. And my mom was one who said, no, like, this is the activity we do as a family. Like, we're all playing soccer. I don't care if you don't like soccer. That's what we're playing. I think from a practicality standpoint, like as a parent, looking back on it now as an adult, there's no way my parents could have gotten us to every activity we ever wanted to do. And they were both working. And so kind of looking at it from their perspective, and they said, it's important that you guys are socialized as kids, but also it's important that we get to spend time together as a family. And so we all kind of got to pick and choose a few activities, and he and his siblings were really, really involved. My mom is definitely a clean freak, which is not the case for everyone's parents. But what her standard of clean, I think everyone's standard for everything is a little bit different. What are the traditional foods we eat? What do our holidays look like? I actually grew up in a family where my dad went to a different church than us. And so I think that influences some of the ways that I just kind of operate on a regular day or weekly basis. And so what's kind of my normal is not his normal. And I think when you look and say, I didn't realize people did this another way.
Yeah.
And I think that really, when you spend as much time together as you do with someone you live with, you don't realize it until you're kind of in it together, that not everyone did it this way growing up, or this wasn't the way every family handled a situation like this. And so kind of seeing that in real time unfold
Yeah,
is,
and
I think.
I know in your family, your mom is Polish, and so is that like a lot of the traditions that your family does too?
So I think a fair number of our family traditions are kind of a blend, because my dad grew up just outside of Nashville and my mom's actually a first generation American. She's Polish. And so a lot of our Christmas traditions, a lot of our Easter traditions kind of center around things that she did as a kid. Whereas like our Thanksgivings, our 4th of July, excuse me, all kind of tailor more towards what my dad's family might have done when he was younger. And so I think it's a fun blend. As someone who doesn't like mushrooms, Greg is not looking forward to our Christmas Eve, because Polish Christmas Eve is usually meatless and a lot of the dishes are mushroom forward. And so he and a couple of my brothers-in-law are like, why mushrooms? Why all the mushrooms? And I mean, my brother feels the same way and he grew up steeped in it. So it just kind of depends, but it's one of those fun things that you get to kind of incorporate, what are going to be our traditions going forward. And so that's one that's really important to me. I miss to hang on to. And I think it's going to be fun to blend family traditions and not have to kind of split holidays, because his parents and my parents live less than a mile apart. And so knowing that on any family holiday, I can see my family and his family. We hang out with my parents for lunch on Sundays and usually see his parents for dinners.
Nice.
It's good to have that family time and get to see everybody and kind of stay involved with what's going on within our own families.
Yeah, I was going to ask about that if you thought about how you're going to split that up, but it sounds like you really don't have to for the most part, which is really nice.
It's one of those things, like we kind of are really fortunate. I think that's one of the things people don't realize, like when you marry someone you grew up with. We had known each other since the early 2000s, so 15 plus years, before we started dating even. And so like we weren't friends in high school, but his parents were my parents' emergency contacts, and like we carpooled with them to and from band practice. And so it's one of those things you just don't think about, having been a part of somebody's life for so long, that like this is going to be very convenient for us.
Yeah.
And I'm selfishly kind of grateful for that, because both sets of my grandparents live over a 6-hour drive away from where we live now. And so knowing that they're really close by and they can really be part of everything that's going on in our lives too, to some degree, is really exciting for us. And I know he feels the same way, because his grandparents are also both sets are far away.
Yeah, I've never lived in the same place as my grandparents. They're always a drive for the most part. That's really cool. Um, I've totally forgot what I wanted to ask you, so I'll just ask you something else. So you sent me a picture of you going skydiving, and I didn't know you did that. I would love to hear
I
about that.
I don't know how I forgot to mention this to you. So as part of planning a honeymoon in COVID times, we really wanted to go on a cruise, and that was not happening. And the reality of what I do for a living is I can't work remotely. That's part of the deal. If you're a community pharmacist, you are physically present, because the pharmacy doesn't open unless I'm there to open it. And none of my team can work unless I'm there to supervise it. So testing positive would have kept me out of work for 2 weeks. And if we were going to go abroad, I would have to definitely COVID test going down and coming back. And I was like, is that really a risk I want to take? And how unhappy would my boss be if I tested COVID positive and got stuck in the Caribbean? I think the answer is very. And so we went to the Florida Keys and stayed at an all-inclusive resort, which was really fun because I'd never been down there. And we flew to Miami and then drove the rest of the way. And we took a day trip down to Key West. And one of the things that I joked about is like, this place is so cool. Why? What else could we do in Key West other than skydive over the Keys? And we had talked about this months ago and hadn't brought it up again. And so we went down and we were kind of just touring the area, wandering around, grabbed some lunch. And he posed the question, like, what do you want to do this afternoon? I was like, well, we could go. And he was like, what if I told you we only had an hour and a half because we have an appointment to make? And so we went surprise skydiving. I think I would
Wow.
have made different lunch choices had I known, but it was perhaps the most fun thing I've ever done. Um, because you fly up in like this teeny tiny little two-seater plane and you tandem jump because they're not going to let you skydive not knowing what you're doing. And so it was just that moment where you are being jumped out of a plane because you're more falling and they're more jumping. There's that instant moment of panic, and then you're like, oh, I'm fine. This is fun. And
That's
so to be able to do that together and let that be kind of how we started off our married life was with an adventure. I don't know it's something I'll ever do again. I think once was enough for me. I don't think I'm quite that much of an adrenaline junkie. But it's one of those things to be able to say, hey, I did this and it was really, really fun. I think everyone should try it at least once. I know that it's not for everyone, but I had such a blast skydiving.
cool. That's awesome. Well, on that note, I think we're probably kind of at time. So you have like a pharmacy specific social media account. Is that something where you're willing for people to reach out to you?
Sure, that's probably the easiest way to get in touch with me. I'm at Katie the Farm D. I have not been actively engaged on social media. I'll be completely honest with you. Um, COVID season, it'll get you.
Yeah.
But um, I really like it as a platform just to be able to get kind of facts out there about what's going on in the pharmacy world. What are kind of hot topic issues? What does a pharmacist do? But it's an easy way to reach me, and it's something that I have on my person all the time because it's Instagram. So
Yeah.
it's on my cell phone. So an easy way to reach out if you've got questions or want to know more about what a pharmacist does, what kind of training I had to do to get to where I am now. Um, I love talking about pharmacy. I love talking about vaccines and immunizations, kind of what pharmacists can do and what I think they'll do in the future. And so, an easy way to get in touch.
Awesome. Well, thanks so much for joining, Katie. This was a lot of fun.
It was good talking to you, Rachel. Thanks for inviting me.
Thanks for watching. Be sure to like and subscribe so you don't miss a single show. Interested in being on the show? Know someone that might be a good fit? Use the nomination form in the description.